Good morning. It's wonderful to be here with you all for our second featured session of our 2022 Smart Start Conference. This is on the power of collective action. My name is Amy Cubbage, and I am president of the North Carolina Partnership for Children. I am thrilled that we are now entering our second week of focused conversation on topics or through lines that came from our first initial 4 days of conferencing a couple weeks ago. Last week, we had our first featured session, and it focused on developing bipartisan consensus on early childhood education. Today, we're meeting from 10:30 till 12 with a session exploring similar strategies across 4 organizations, looking at efforts to mobilize communities through strategic partnerships and coalition building for early learning. Next week is our final session, and it will be from 10:30 to 12 again on May 26th. And that one will be focused on exploring national, state, and local workforce supports for early childhood professionals. Today, I am thrilled to be on with a terrific group of panelists and a wonderful moderator, Ken Mitchell. Ken is Senior Director of State Affairs with the National Head Start Association. We had worked together a little bit in a prior career for me, and I'm a prior organization, and I'm thrilled that you're here with us today, Ken. Without further ado, I will turn it over to you.
Great. Great. Thank you so much. And I love the way you're doing this conference and stages, really innovative and different. I love to see that. And excited to have everyone on the call today. Thank you for making the time out of your busy schedules. Like Amy said, we're here to talk about collective action. I come from the Head Start community. Collaboration and collective work is so incredibly important. It's actually, yesterday was Head Start's 57th birthday. And the power of collaboration has been so important for the children and families served by Head Start, over almost 40 million across those years. So excited to have perspectives from wonderful leaders from 4 different initiatives, teams here today from Texas, Illinois, South Carolina, and Louisiana. So thrilled to have some diverse perspectives on the call. In a minute, I'm going to kind of frame the issue a little bit, but I do want to recognize we're in a really unique and urgent moment for families in this country with the infant formula shortage. I wanted to go ahead and drop in the chat a couple resources that you might find useful as you interact with families. You may have seen these already and used these resources in the last couple of days or so. But we both need to connect families to formula, but also to protect against dilution and other actions that families might be taking. So I want to provide those 2 resources and understand that collective action here is more critical than ever. And I know our government is doing a lot to intervene in this way to protect our youngest and most fragile kids. So if we could go to the next slide, I'll walk us through some of the framing here, and then we'll get started with our panel. It's obvious that we're in an unprecedented time of change for families. I always start these presentations pretty much the last couple of years saying this because it's important to take a step back really and recognize how big the issues are facing families. So many families, especially women who want to go back to work but lack childcare, they need that childcare. They need early childhood education to support their family and support themselves. In the workforce itself for early childhood and other human service areas, we're seeing the Great Resignation. We're seeing staff who are burned out, who are not compensated well enough, and who are quitting the profession. And we know that that causes damage to the relationships that they build and the strength and the quality of programs that we all want to see for our youngest children and families. And mental health, I think we're if there's one silver lining of the pandemic, actually starting to talk more candidly about anxiety, depression, grief, mental illness, and how many of us are struggling with those issues. And that will be a struggle I think our country will face for some time, including young children, including families with young children who went through this pandemic. Next slide, please. So unfortunately, a little more gloomy news. Congress is retrenching. I don't think we should expect Congress to save our communities, I think that's up to us. And I think states and localities are going to be so critical in the coming years in this front. COVID era relief, a lot of that relief is expiring. So millions of more kids have fallen into poverty, and inflation, we know inflation is hitting poorer families the hardest. It's those families who need basic goods, the groceries, the gas to get to work, et cetera. They're hit hardest by inflation. So unfortunately, you know, those are things we have to contend with. And next slide, please. So this is kind of a glass half full and glass half empty slide. I think in one sense, we've got a lot of fragmentation in early childhood. But on the other hand, we've got a lot of assets and programs. We've got, I particularly like how this graphic from Bill points to parents and the strength of parents and the assets parents bring to this work, and that we need to center children and families in how we approach this work and think about them as holistic people, right? Human beings who need a whole range of services. And that's why states and localities and collective action is so critical, because no one organization can meet these needs. And so that's why what we're talking about here today is so important. So I want to share this graphic from the Build Initiative here. Next slide, please. So another reason we need to really focus on collective action is segregation and racial injustice. I use this graphic from Erin Hardy at Newark, all credit to her, and it shows segregation in Milwaukee. And so just to walk you through this, if you look on the left-hand side, every single dot there represents 500 white children. And so you can see the broad disbursement of white children around the Milwaukee metro area. And then the graphic on the right is Black children, and you can see the extreme concentration. And what do you notice? Those dots do not overlap, right? So we have extreme segregation in the Milwaukee metro area, but also in many other metro and urban areas across our entire nation. That's why coordination and state and local coordination and cooperation are so critical. And we need to recognize these injustices and work to overcome them. Next slide. So we did a review recently in Head Start. It was the first time in about 25 years we did a really scientific research-based review, talked to everybody in our field, massive survey, all kinds of literature review, and identified a large range, 7 main barriers to access, equity barriers, that really local actors are best suited to overcome, right? In this case, that would be our Head Start grantees, but you all work with childcare, with pre-K, with home visiting. Local actors, local collaboration, and state collaboration are critical to removing inequitable barriers to access, which include transportation, different eligibility limits and paperwork, a lack of supply in childcare deserts or other areas, inadequate hours of service, et cetera, et cetera. So just stressing again how important it is that collaborative and collective action work to remove barriers to access. Next slide. So I won't go into everything here. You'll see the tiny graphics here. We'll try to get these, the link to you. But a wonderful organization, Mathematica, is doing a rigorous review of collective action in early childhood and health and human services, and how coordinated models can look. On the left-hand side, you'll see examples of state models. And the right-hand side, you'll see examples of local models. I 100% expect we will see 2, 3, or 4 of these on the call today when we hear from our team. So just want to let you know there's empirical work happening too to try to understand best practices in this area. Next slide. And just another slide with some of the key elements to keep in mind. I'm just going to highlight a couple things here from the Build Initiative graphic. One, best practice engaging with and centering the voices of families and communities. We're going to talk extensively about that today and how these 4 initiatives attempt to do that, and also acting intentionally to reduce racial inequity. So I'll just point out a couple of the best practices there in collaborative work. So with that as framing, you can see how important this topic is for our nation and for our kids and our families and our communities. And if we could go to the next slide, I'm going to turn it right over to our first team and our first initiative. So I want to take a brief moment here to introduce Nicolee Johnson, who is the manager of Early Matters at the Commit Partnership in Texas, and Jacqueline Adam, who is the director of Pre-K-12 initiatives at the commit partnership in Texas. So I will turn it over to them for their presentation, and each of our teams is going to walk through their purpose, their origin story, their impact, and where they want to go next. So you're going to hear that from each of our teams today. So Nicolai and Jacqueline, thanks for being here today, and I'll turn it over to you.
Okay. Hi, everyone. Welcome. So happy to see you all. Thank you for having us. I'm Jackie, and I'm just going to give you a brief overview of who is Commit. Commit Partnership is a nonprofit organization that serves as a community connector. Our work is positioned upstream with a focus on shifting and changing education and economic systems. Our North Star goal is that by 2040, at least half of all 25 to 34-year-old residents in Dallas County, irrespective of race, will be provided the opportunity to earn a living wage. To increase living wage attainment, we must equitably increase educational attainment, maximizing the cumulative effects from early education to college, career, and/or military readiness. In order to achieve our mission, we partner with over 200 organizations, including public and private schools, colleges, universities, businesses, and other nonprofits. We carry our work out by implementing an analyze, activate, and grow model. And if we can go to the next slide.
Yes. So since living wage attainment begins with early education, Commit has aligned with Dallas County early childhood, with the early childhood community around goals and strategies. And so our main goals and strategies for early childhood are kindergarten readiness, increasing kindergarten readiness, and also increasing third grade reading. And so you'll see some of our levers to those two particular goals. So one of them is to increase access to quality early childhood education and ensure that the awareness and demand for quality early childhood learning is there, and also to improve the quality of early childhood education and to extend the continuum of care to support children and families from birth. Next slide, please. So we know that living wage attainment does not begin and end with post-secondary. So we must start from pre-K enrollment. And so that's our main point of this slide, is to show that a living wage attainment, which is our North Star goal, starts with a great foundation in pre-K enrollment. And that sets children up for success all throughout their school experience. Next slide, please. Yes, and so this is really telling the origin of our pre-K campaign. One of the main strategies that we're using to increase kindergarten readiness is through our pre-K campaign. And so our campaign started in the 2014-15 school year with only 2 districts in Dallas County, DISD and Grand Prairie ISD. And they were aligning on a common enrollment period and also strategies for getting the word out about the significance of pre-K. And during the time when we started the pre-K campaign, many of our districts did not offer full day 4-year-old programs across Dallas County. And so our pre-K campaign was very significant in helping our districts to see the importance of pre-K and also getting on board with offering a full day 4-year-old pre-K. And as you can see, since our pre-K campaign began in 2014, we've increased to 16 districts, and they're all contributing to a joint media buy of over $160,000, which is mainly a TV and radio ad buy to where we're reaching millions of families about the importance of pre-K. Next slide, please. Next slide, please. And so this is showing out the impact of our work. So as you can see that since the beginning of the campaign, we have increased pre-K enrollment across Dallas County by 10 percentage points compared to only 3 percentage points across the state. And as you can see in 2020-21, when the pandemic hit, we took a decline of about a 10 percentage point decline in our pre-K enrollment. But the good news is that this current school year, we were able to increase that by about 6%. And so we're really, really proud of the impact of the work of our pre-K campaign. Next slide, please. And so this is one of our big wins. So in this current school year, 11 out of 16 of our participating districts exceeded pre-COVID enrollment. And nearly every one of our districts is at least 90% of pre-COVID enrollment. So this is a testament to our districts really banding together to really dig into those innovative strategies for continuing to reach families about the importance of pre-K even throughout the pandemic. Next slide, please. And so while our campaign has reached about 80% of our 4-year-olds, eligible 4-year-olds, and about 25% of our eligible 3-year-olds, we know that we still have a lot of work to do, especially to recover from the loss of enrollment from the pandemic. So this is why we're using our grassroots pre-K campaign, or we started our grassroots pre-K campaign rather, to increase access to quality pre-K programs in DISD. And we started piloting this in DISD because DISD is one of the largest school districts in Dallas County. So they are the holders of most of our pre-K seats there. And so the grassroots campaign really just consists of that boots on the ground approach to reaching families, such as door knocking and surveying parents in targeted zip codes where there is low enrollment but high number of eligible students in those areas. And so we're working and partnering with a place-based organization, Texas Kids First, to execute this grassroots campaign. And I think that's it. Thank you so much for having us, and we're welcome and open for all questions, and I'll turn it back over to Kent.
Great, thank you so much. Great analytics in there. I really appreciate how you showed the statistics, also the COVID drop, and then the COVID rebound. I actually just wanted to ask a quick question about that, because that is impressive. And I think as a country, we're worried and going to struggle with that. So obviously you're pointing to some of the grassroots work. Are there any other lessons you have found from the last year or so to help that rebound that you'd like to share with the audience here?
Yes, I would say that many parents during the pandemic, of course, grappled with their children's safety. Of course, that was one of the main reasons why parents were not enrolling children in pre-K. So one of our strategies for recovering some of those students was that we convened with districts, and most of them put out videos of safety, their safety measures, like what it would be like a day in the life of a child in a pre-K classroom, and showing the safety measures that they were taking to ensure that children would be kept safe and healthy during those times. And then with our grassroots campaign, which we just piloted this school year, we're digging into going to neighborhoods and door knocking and surveying parents to find out why they are or are not enrolling their children in pre-K. So really, we're elevating the parent voice, which we had not done so in the past. We did a lot of quantitative data, but we didn't get that qualitative voice, that data that we needed. And so we're really focusing on getting those parents to be ambassadors in these neighborhoods to get other parents to enroll their children in pre-K. So I think it was really just getting the parents' voices and allowing what they needed to drive our messaging, or for us to modify our messaging.
Excellent.
I would just quickly add to, like, on a more strategic point in terms of enrollment and FTEs and budgets. Like, our districts are bought in on the superintendent's level about pre-K 3 and 4 being the highest number. Like, that is the population of students that can increase the most and will constantly grow. And the rate within them staying in their district, if they have a good pre-K 3 or 4 experience, is they're most likely to stay all the way through 12th grade. And so we've been able to, like, hearts and minds with families, and also look like very much operationally budget-wise best outcomes for districts, for them to kind of come together in the middle to ensure that we have more students in pre-K.
Wonderful. Well, it's clear you guys have done a lot of work to understand issues and barriers and to bring folks to the table. We'll return to all that in our Q&A. I want to turn next to our next partnership from Illinois. So I want to briefly introduce Cicely Fleming, who is the State Director for Regional and Community Systems with the Illinois Network of Child Care, and Ceci Nyman, who is the Senior Policy Analyst and Special Projects Director for Illinois Early Childhood Transformation Team, the ECTT in Illinois. So Cicely and Ceci, take it away.
Great.
Thank you, Kent. I think Ceci is going to start us off here.
Yep. Welcome, everybody. Thanks for being here, and we're thrilled to share some of the work that we're doing in Illinois around systems building that really has a very long history, over 20 years, that we've been thinking about this and actually working to operationalize at the local level in terms of local collaborations to really bring communities together around early care and education, to prioritize it, to identify targeted needs in communities, and to really lift up and empower parent voice as how we think about and move a high quality early childhood agenda forward in Illinois. I was lucky to be part of those early efforts while I was at Illinois Action for Children. That was foundation funded to really start to think through and operationalize what this might look like. And I'm thrilled to be part of the next stage of that, which is what we're going to talk about today. So like many states, have a mishmash of early childhood funding streams that we encourage in trying to facilitate providers to blend and braid in order to provide high quality early childhood. And like probably many of you, some people figure it out and some people don't. And what that does is create an incredibly inequitable system in terms of who we serve and how we serve them across our state. I should give a context that Illinois is, I like to say, because I come out of community organizing, it is 11 hours long and 4.5 hours wide. We touch the Mississippi River and Lake Michigan on each of our east and west coasts. We touch Kentucky to the south and Wisconsin to the north. So we have 102 counties and over 850 school districts. So we have incredible diversity, both economically, both geographically, except it's all flat, just trust me on that, and racially. And so we have to think we have to be very thoughtful about how we approach systems building and how we approach policy change in Illinois. So in December of 2019, the governor launched a funding commission to really look at Illinois' early childhood governance and financing system, and to really make some recommendations to the state to how we can improve services for children, improve access for families, and to embed equity at the very center of how we offer services to families. So as a result of that, there were core recommendations that were made to move some of that forward and to do more due diligence on some of those aspects. The thing that was the most clear in the governor's eyes was to create a regional infrastructure of community systems, councils that will bring regions together across the state to prioritize early childhood, to really lift up what had already been happening somewhat organically at the local level, to really systematize that at a regional level, to truly inform policy and governance and financing of our early care and education system, and to more systematically and consistently engage parents and providers in those conversations. So we really tackled this idea of bringing multiple funding streams, multiple sets of service program rules and regulations. So early childhood, our child care system, which is funded through federal and state dollars. We have a state-funded PreK program that is complemented with our preschool development grant, where we can do a preschool expansion grant. And of course, we have Head Start and Early Head Start. So how do we bring all those programs together to make sure that we're not creating deserts and pockets where families have no access, and particularly have no access to high quality care? So this was really our charge. And the primary solution that we identified to operationalize equity across the state was to really create a regional council of what ended up being Birth to 5 action councils. So we are thrilled that we are taking that local collaboration, valuing that, maintaining that, supporting that, and then adding on a layer that really does scaffold up to truly inform the state in terms of what's happening with children and families. Our program funding streams are siloed, right? Different agencies administer different funds with different regulations, and so they become very siloed. What we need to do is create a mechanism by which we get that whole picture of what are programs accessing in terms of serving the children in their community, and does that match the need that is there? That includes early childhood special ed, early intervention, all the services that we know are critical to children birth to 5. We have a complex infrastructure of early care and education. We're really starting with kind of that early education aspect. And as councils are developed, and Cecily's going to talk a little bit about that, we will expand to the full suite of services that we know children and families need to thrive. We have to stop putting the burden on families to figure out an incredibly complex system. That is the responsibility of government, and our initiative around community systems building is our solution as to how do we take that burden off the shoulders of parents and take that financing mess off of the shoulders of providers, and to really bring that into government and to more systematically and equitably fund early care and education, support the provider workforce, support families to access care, and to really set all children up for success through their life. So that's really the why of our early childhood birth to 5 action councils across the state. The first job that I had coming onto the early childhood transformation team almost a year ago, which was created to really operationalize those recommendations, was to bring Cicely on to lead this effort. And she has done a yeoman's job. And so I'm thrilled to partner with her and to turn this presentation over to her.
So I am Cicely Fleming, the State Director of Birth to 5. And as Ceci said, we came straight out of the governor's recommendations from the Early Childhood Funding Commission. And so one thing I want to bring to light, and Ceci talked a lot about kind of the structure we have in the state of Illinois that can be very burdensome, not only for our families to access, but as well for our providers. It's just a couple of small data points. So when the commission started its work, which was right at, I believe, the beginning or right before the pandemic set in, some of the numbers they looked at to really highlight the inequities were that we have about 800,000 children under the age of 5 in Illinois. So this data point is probably almost close to 2 years old, but probably around the same right now, because things don't change that fast. Of those 800,000 children, about 40% of them live in what we call low-income families. And so we all know the data on that in terms of the burden of low-income families being predominantly on African-American, our Latino, our immigrant populations. And of those 40%, only about 50% of them are receiving early childhood services. And so that really shows us the disparity across our state, and I would probably guess across the US, in terms of what we're looking at and who we're serving, who has access to care and quality care that Ceci mentioned. And so what's on the screen now really is highlighting kind of 2 Illinois for us. And so the left map, which I know there's some key points there that aren't really that relevant for you to zoom in on, but the left map is showing kind of what we have now across the state. And so there's some purple, there's some green, there's some orange, there's some yellow, there's some lines. And that just kind of highlights a variety of different coordinated services. And so the purple ones are the local community collaborations that really have grown up out of their community need to help families access this kind of complicated system we have now. They don't receive any state funding. They are really just kind of mishmash of funding, whatever they can find. Some of them have staff, some have no staff. Some have really strong foundations that are leading their work. Some are year to year with their funding. And then some of those other colors are where we do have some state funded systems, but as you see, they're not all over our state. And then just the other colors are a variety of things. But this really map on the left shows us what we have in the state of Illinois now. What I'd like to highlight is that the light blue is really where we don't have anything, right? And so we don't have any kind of local collaboration. There's really no state funding program that's working to help families kind of navigate our complicated system. And so we have the majority of our state where families are left with not only the complicated service delivery Ceci talked about, but they're also trying to figure it out on their own. We know that there are lots of people doing lots of work. So we don't want to negate things that are happening in those blue spaces. But when we look at kind of a system that we understand on the state level, we're unclear of what's happening in those light blue spaces, or there's really nothing happening. On the right, the map with the bolder colors is really what we're trying to accomplish at Birth to 5. And so as Ceci said, our work really comes exactly out of the funding commission. We try to stay as close as possible to what they recommended. And one thing they said is it's clear that on the state level, they don't really know. We don't really know what's happening, what family experience is. We have some data points in the state. They're not the best data points. They get to the providers, excuse me, they get to the state about a year late based on the reporting. And so we can look and see in some areas we might have a wait list for preschool for all, whereas in other places we might have open slots for preschool for all. And while that's a good data point, we don't really know why that's happening. And so the birth to 5 action councils and family councils, as they're set up, will follow this map to the right. And so each of those colors represents where we will have not only the councils, but we also have state funding for staff, which is huge because, as I mentioned with our other local collaborative efforts, what they will tell you hands down is that they don't have funding for consistent staff. And as you know, when you're putting this work on the back of a parent or another volunteer, things fall through the cracks because people are also trying to juggle full-time jobs or care duties or what have you. And so our structure is set up to have full-time staffing. We will have a regional manager, we will have a family community engagement staff, and we will also have an admin staff who really can, their sole job is to move this work forward. And so that when we have volunteers coming on board to serve on these councils and parents for the stipends we're providing, they can actually focus on the work at hand and making sure we understand from the community level what is happening and what community wants. Part of the way we're going to operationalize equity in our efforts is the state already has put out a list of priority populations. They've already done the work to identify who we're missing, not only in terms of parent voice, but who is not accessing services, who's not accessing high quality services, who has the greatest barrier to services. And there are a list of about 15 priority populations. Obviously, like many other places, they involve people of, people of color, people in low income housing. They also are migrant families. We have a lot of migrant families here. We also have families who speak English as a second language. We have families who are caring for children whose parents might be incarcerated or just kind of don't have rights to their children right now. So there are a variety of populations we're trying to focus and make sure we understand what's happening for them in these regions. If we can go to the next slide, it'll kind of show you how we're going to do some of this. So we want to make sure we have, next slide, please. We want to make sure we have authentic parent engagement. So as we all know in this work, there's lots of parent councils and parent advisory groups, and they're all doing a variety of things, but that information doesn't always flow to the decision makers. And so what we want to capture here in our councils is to make sure we are prioritizing those priority populations as well as all minoritized people in this engagement effort. And so we want to make sure they have a seat here on these councils and we are truly listening to what they say, and that's captured in any information we provide to state leadership. We want to make sure that we are having service delivery within the community that works for those populations. If we all understand true racial equity, we know that if we focus on those who are most marginalized, it does nothing else but lift up everyone else. And so we really want to make sure that our recommendations and that the experiences we lift up are those from our marginalized populations, particularly by race, but then also looking at other categories. And as Ceci mentioned, in our state, we are very diverse. So we do have areas in our state where already people have come forward and said, well, I'm not sure we need to focus on racial equity because we just are not racially diverse. But we challenge that and say, if we still focus on the marginalized people in your community, whether it's those who are marginalized based on where they live, based on their education attainment, based on their salaries, based on being rural or maybe detached from services just because they don't have transportation, that is going to make service delivery better for everyone in the community. We want to make sure that we're capitalizing on what's happening already in the communities. And so where we do have those local collaboratives, we have gone into community to partner with them to add our staff to their to their work and elevate their service in ways that they might not be able to just because they don't have access to funding and staff. So we want to make sure that we're doing this in a way that is really a collective impact model, that the state is not seen as coming in as a separate actor, but really coming in as a partner to these communities. We want to make sure we can bring all of the advocates and all of the service providers to one table and talk about what their barriers are, not only in accessing the funding kind of craziness that Ceci laid out, but what their barriers are to reaching parents, what their barriers are to maybe extending the service that parents might be desiring. We know we have lots of family home care providers that did close down during the pandemic. We also face the same issue that the previous speaker spoke about, with lots of parents not returning to care after the pandemic. We also face huge burnout from our staff that was probably building during the pandemic and just kind of tipped over the edge. And so there's lots of reasons people aren't accessing care that the state doesn't understand. So our first go at that really for this first year is to do a regional scan to really understand exactly what's happening in the community. Again, centering parents and providers because they are the ones who are closest to the service delivery, and making sure that we then bring in all other voices. So elected officials, we want to bring in faith leaders, we want to bring in business owners, a variety of people who historically maybe have not been part of these conversations, to make sure they understand that this is an all hands on deck initiative, that everyone needs to take responsibility for making sure that their community and that the children in their community have access to care that they need, because we all know that the data says access to quality early care education is really going to catapult people's life expectancy and their ability to attain higher education. So we want to make sure Illinois is the place that happens for all of our students in every region, no matter what the demographic is, and really no matter what the socioeconomic status of that community is. Next slide, please. And so this is our mission. We want to, again, create this statewide regional infrastructure. We want to amplify the voices of community. We want to prioritize those who are historically marginalized and left out of these conversations. And we want to mobilize the community. We don't want to come in as a state and tell the community what they need. We want to really bring them together, provide this infrastructure and support across the state so that the community can see their role not only as advocating to the state, but by bringing in those business owners and other stakeholders. We think we really have a good chance of leveraging some things that have not been leveraged to expand early learning, whether that's facilities, whether that's helping with workforce training, whatever that might be that the community can offer. We want to really bring everyone to the table to really start brainstorming this and making a commitment to this in the future work, and really to get our state where our governor wants it to be as the best place to raise young children in America. We have a ways to go for that, but we do think this is a great model. We realize that North Carolina and other states have started this work already. We're happy to, learn from their work and build upon what they've found as successful. And we'll continue to recreate this as we get into community. We just hired 17 of our 39 regional managers. So as they get in community, we anticipate them having lots of feedback, and we want to make sure that these councils and that our efforts really work for community. We want this to be totally community driven, with the state really as the funder and the supporter, but making sure parents and providers and community leaders understand that it is their voice we want to prioritize as we're doing anything we can to kind of reconfigure our state system to make sure it works for parents and providers. And so I'm happy to take any questions or turn this over back to Kent to lead us to our next speaker.
Great. Thank you guys so much. My family's from Peoria, Illinois, so this is particularly exciting and interesting to me, knowing my dad grew up in there and important to my family. But I wanted to ask you a question that came through the chat. So one of the questions was, you said there were these local efforts that were just kind of grassroots, not really funded or coordinated. Have you been able to hire people who did that work, right? Who are now going to be able to be paid for that work, sort of a grow your own type approach there with those leaders?
Yes, we've done a couple of things. We are super excited. We just had a press release that came out yesterday that's on our website of the first 17 regional managers we've hired. We've been able to hire people from a variety of early learning spaces. So some former home care providers, preschool directors, Head Start directors, some people who have been with local collaboratives. We have a state system that is our CCR&R, Child Care Referral and Resource Center. We were able to attract a few folks who have worked in that space. And so we're really excited by the people we're bringing in. They're really quite a diverse group of individuals who will be leading these councils, and they understand and have a commitment to the community, which is really important to us. The second part of that I want to address is that of those local collaboratives that are happening organically, there are a handful of them that are working on this regional level already. They're covering 1 or 2 counties versus just covering small municipalities. And through various conversations, we've been able to work with them and kind of really formalize a partnership. And so we'll be building on the work that they're doing. And so, for instance, there is DeKalb County, that's its own standalone county. The ROE there is leading a regional collaborative. That regional collaborative will now serve as the Birth to 5 collaborative. So we realized we didn't want to come into community and make something different and it confuse people even more. And so we will be expanding and building after the work that they've already done. They already have community presence. They already have community respect and trust. And so that's very important. And so we just really would be kind of building on and expanding their work in a true partnership.
Ceci, did you want to add anything?
Yeah, I would just add to make sure that it's clear that the locals aren't going away. We rely on those locals. And one of the first charges of those councils in those areas where there aren't strong local representation, because that's really the boots on the ground. That's where we're really going to engage parents. So though we are supportive of and trying to expand that local. So going back to the map, we don't want any blue. We want locals across the state. And then they're going to partner and really be part of the larger infrastructure that we're building out with these regional councils. So we're excited to kind of build on the knowledge that's been established at some of those locals. We don't want to steal their folks because we need them on the ground, but really excited to bring a lot of early childhood expertise and years of service into these regional councils to really lead this work going forward.
Great. Well, it's great to be in conversation with you about the kinds of skills, attributes, qualities you want in those leaders, and growing their own and elevating people who are so passionate and committed and skilled at that work. So we're going to head to our next partnership here. And so I'm going to turn it over to Rachel Hatton-Moore, the 2-generation coordinator with South Carolina First Steps and South Carolina Early Childhood Advisory Council, and Georgia Martin, the executive director of South Carolina First Steps and South Carolina Early Childhood Advisory Council. Welcome to you both. Excited to hear about your work.
Thank you so much, Kent. It's a pleasure to be here and just to listen and learn from our colleagues. South Carolina has a system that looks a lot like the system that Illinois is now working to build. We modeled our locally driven, coordinated hubs of direct service to children and families after North Carolina's Smart Start. And we did that 22 years ago. So on the one hand, we are incredibly blessed in our state with this local infrastructure, with these system navigators and these direct service providers. And so as the executive director of South Carolina First Steps, I have the pleasure and privilege of leading our funding and service and support through that network of 46 county level local partnerships. They provide services to 37,000 children birth through 5 across the state. But what we found was that we also have another important role to play, right? So if you go to the next slide, you're going to see that South Carolina First Steps, this sort of hyper local public-private partnership, is only one piece of a very complex early childhood state system. Every state has an early childhood state system, and typically they're focused either specifically on early care and education, or even more broadly with the hope and desire to get all kids ready for success in school, to ensure that our young children are healthy and safe, and oftentimes a key focus on the role of parents and families and communities in supporting the nurturing and growth and flourishing of those young children. And so in South Carolina, we have this system. We have 44 different programs in place that aim to fulfill this goal, right? These core goals of healthy and safe children, of children who can access high quality care and education, who are learning and growing and getting ready for school success. But the challenge is, we mapped this out as a state and we said, this is incredibly helpful. It's super helpful for us as policymakers and state level leaders. It's super helpful to our legislators and the governor's office to see this all in one place. But by golly, is this map helpful to children and families? Not really. So I want to share a brief story before I pass it to my colleague, Rachel Hatton-Moore, who is South Carolina's inaugural 2-gen coordinator. The story I want to share starts with the fact that I'm a mom. In addition to my leadership role in the early childhood space, I'm also a navigator of that space, right? So I spend a lot of time with my 3 young children at parks and festivals. And about a year ago, it was coming into summertime. We were ending the school year. I had a conversation with a mom, and she was there. She had 2 school-age children, and she also had a 3.5-year-old rising into 4K, as well as a young child, an infant who was in her arms as we were speaking. And she saw that I had young kids, and she had been in the state for a while, but she was an immigrant to our country. And she and her husband were both working. But unfortunately, because of her lack of childcare, or rather lack of knowledge of the available resources in our system, she was describing to me how she and her husband were juggling times when they were working so someone could stay home with their newborn and their rising 4-year-old. she asked me what I was doing for care in the summer, and she asked about resources. This experience just reminded me of how important it is at a time like that. Remember last summer, all of those resources that were flowing into states from the federal government to close those gaps in learning, all of those COVID resources, the fact that most states had greatly expanded the reach of their childcare subsidy. And yet here was this family who had dual language learner children who absolutely qualified for all of these benefits and supports, and they didn't know about it. And what that meant was that those kids were not going to be ready for school. And it also meant that mom and dad could not re-enter the workforce at a time when we really needed that workforce to be able to engage, right? So what do we do as a system during COVID? And I want to point that out. While we were all working remotely, while we were all on our computers, more than we ever wanted to be, we realized that the hyper local build out was not enough. We needed to do something at the state level. And so Rachel Hatton-Moore, our 2Gen coordinator, came in and really has helped lead us through the development of our solution. So I'm going to turn it over to you, Rachel.
Thank you so much. So if you could go to the next slide. So where are we at based on where we've been, right? So we took all of those complicated, array of services across all of those different silos and entities, and we broke them into 5 simple categories that families could navigate through depending on what their needs or interests were. And they could learn about the over 60 programs and services that are featured on First 5, and we leveraged PDG funds to build this. And so we were also able to build this portal with 44 programs on the eligibility screener. And I dropped into the chat how you can test the eligibility screener if you're interested in looking at it. We built it across 5 simple screens, and we took all of the eligibility criteria for these meetings through a long discovery process with each of the programs and agencies, 11 agencies that are featured. And we were able to make it simple for families to find what they were looking for, to see what they might be eligible for as closely as possible, so that they could then navigate to those agencies and save time and learn more about what would be available to them. We also mapped it out by community because we know that oftentimes some community or publicly funded programs might not be available in every community based on the community needs. And so whether a family is in the low country of our state or whether they're in the upstate, they're able to find out regardless of if an office is open or if an office is closed, whatever time works for them, they can go to the site and find the information. So I also wanted to just tell you about the site usage. We first sort of launched as a prolonged test in December of 2021 with a wide public launch in February. And since inception and release, we've had over 55,000 page views for over 19,000 unique visitors. And in April was the first month that this was available. We created a way for programs to access leads from the families who might be eligible for their programs and services. And so far, we've had close to 300 of those leads available in just 1 month alone. And so that means that families are getting closer to the programs and services that can best benefit them, because our long-term goal, which I know all of the states here share, is that families in our communities have the conditions and the support they need for themselves and their children to flourish. So if you could go to the next slide. How do we center family and community voice? That's really important to us here at First Steps on the Early Childhood Advisory Council. We will be launching a stories campaign later this year through our wonderful communications team, and our communications director is here today. And this is one of the families, and Ms. Sawyer is also on our Family Voice Council. And the Family Voice Council provided feedback into the development of First 5. We also had a family focus group. We had community meetings throughout the development, and really took that feedback into heart. And you can see a lot of the changes based on their input on our site. And that's really pivotal to the way we are also moving forward with the development development of a common application so that families can not only find out what they're eligible for, they can take that next step and begin the application process and submit applications. And that'll launch later this year. And we're really excited about that and continuing our work with the many agencies that are featured on First Five. As a collaborative effort across the state, and part of our vision and our collective responsibility to the residents of our state. So that is all I wanted to say at this moment, and we look forward to speaking with you more about this and answering any other questions that you might have. And I'm going to turn it back over to Kent. Thank you.
Yeah, thank you guys so much. We do have some questions. I saw Georgia was active in the chat. I do want to lift that question up. Because that question of equitable access is really important. The conversation in the chat was talking about work requirements and particularly maybe some differential impact on the Latinx population in the state, but there's all kinds of barriers. So can you speak a little bit to how your work is trying to understand and then address and remove barriers? And you can speak specifically to the work requirement too, that would be great.
Thanks so much. And I think that question is really important. We are in a state where our governor and our leadership sees the value of work and knows how important our economy needs the workforce, right, to thrive. And so as a state agency, and across our early childhood state system, we are supportive of work and school requirements. And at the same time, we know that there are subpopulations where that is a huge barrier. And so, what we've really worked hard for is a both and. And I think what we've done with that both and is carved out in our childcare subsidy subpopulations, special set aside populations, and dual language learners in our state is one of those set aside populations, right? Another special population that we carved out through our collaborative efforts, where some of those requirements that are broad based are able to be lifted, are families who participate in state-funded pre-K4. What we learned was that our participation levels were not what they needed to be, because it was not that helpful to a family just to get pre-K4 if they could not actually get a child care voucher for their younger siblings or older siblings. And so we set up, in essence, a presumptive eligibility caveat for children who are siblings of pre-K4, state-funded pre-K4 students in private childcare. So those are just a few of those subcategories. There are a number of others, but I would just encourage folks on this Zoom call to kind of think through where are their particular barriers and to approach their child care block grant recipient, which in our state is not us, but is a key member of the system, and to really think creatively about those set asides or those special populations, because that's been incredibly helpful for us. And legislatively and even, from the governor's office, there has been nothing but support for this. So it's also a way to acknowledge the value and need of those work and school requirements while also acknowledging certain important subpopulations.
Yeah, a wonderful example of holding the space for two values that don't need to be in competition per se, but are often pitted against each other. So wonderful example of how to learn from the community and then to navigate the systems on behalf of children and families. I love that.
The last thing I want to say is this element of family voice is so key. So we've done some rapid cycle feedback loops, and for that specific initiative I was talking about, which we call First Steps 4K plus siblings, which is that bundled sibling voucher for all First Steps 4K families. Even though that school and work requirement was lifted, we actually added in legislation that we would begin tracking work and school participation.
Yeah.
And so doing those surveys and being able to see real time from families that when we didn't require it and it was voluntary, but we gave them the resources they needed, what we found was that families did engage in work and school. And that actually got lifted up in our governor's state of the state.
Yeah.
And so just really important to hear and share out those family voices when we're making this case.
That's wonderful. Thinking about the whole family and their outcomes. I love that. So we want to make time for our next pair. So we're going to move forward to our final team. I want to take a brief moment to introduce Charmaine Cacciopi. Apologies if I mispronounced her last name. You can correct me. The Executive Vice President and Chief Operating Officer of United Way of Southeast in Louisiana, and Candace Weber, who's the Director of Partnerships at the Louisiana Policy Institute for Children. Welcome, Charmaine and Candace. So excited to hear from you today.
Well, I want to thank you immensely. You not only correctly pronounced my name, that's a rarity, even at the state legislature here in Louisiana. I couldn't be more thrilled today than to be joining Candace on this presentation about the significant work that we are doing as the Ready Louisiana Coalition here in Louisiana. I have to tell you that the problem that we knew that we were facing started a journey for us that goes way back. I think it's fair to say that our region and our state suffered greatly following Katrina, which was probably one of the most horrific natural disasters to ever hit our region. And I have to tell you that we were well positioned as a not-for-profit with the United Way to rebuild those centers where we chose only to rebuild to quality standards so that we could not only expand access, but if we thought for a second that we were going to be able to actually recover, it would take significant investment. But we knew that that investment would not stop with just the construction of high quality centers and the restoration of our high quality centers throughout our region and across the state. It would take the formation of a coalition that could mobilize business leaders, advocates, and other organizations behind getting increased investment in high quality early care and education. We knew that we needed to bring early care and education into the mainstream of all conversations and ensure that it was a priority issue for our legislators. You see, those of us who have the privilege of working on the front lines and are engaging with our high quality centers and our families who are looking to place their children in these centers, we understand that issue and we research that issue and we know the challenges as a result of some of the research that our United Way has done in partnership with 11 other United Ways across the state. We published an ALICE report. So for us, making our legislators and our stakeholders understand across this state how incredibly challenging it can be for our community to access affordable, high quality care and education was a top priority for us. So education was at the forefront. We needed to make sure that our lawmakers, our media, and our public were astutely aware that our population, 52%, which lives at or below the poverty line, do not have access if we cannot get increased investment for affordable childcare. I'm now delighted to turn it over to Candace for her to give some insights because they are, as part of this coalition, one of the most incredible research-founded organization. They know that we had to change that conversation and bring the business case to the forefront for us to experience the success that we knew was able to be achieved here in Louisiana. So Candace?
Thank you, Charmaine. Yes, so as you all can see, I mean, Ready Louisiana is the collective identity of the business community, advocacy organizations, and faith-based groups, all aligned on the need for increased investment in quality early child care. And although the coalition was officially formed in 2018 with organizations like Charmaine's United Way of Southeast Louisiana, and also the Jefferson Parish Chamber of Commerce, that journey began well before 2018, as you just heard. And so next slide. Next slide. So where we've gone today, I mean, we started with just a few organizations to now we are well over 100 organizations of businesses, chambers of commerce, civic organizations, faith-based groups, all aligned on the increased investment in early child care and education. And as Charmaine mentioned, you know, there was a point in Louisiana where early child care was not a topic of conversation. It was not a political priority, and now it is. This group also had their first early ed day at the Capitol back in 2018, and that is a day where we all come to the Capitol, we engage with our legislators, and then in 2018, this group also made sure that early care and education was on each candidate's platform for the 2019 cycle of elections. And so now early childhood, just the way we even speak about it, in our state has shifted. You don't even hear the term daycare as often anymore. It's childcare, and ECE is not only just a women's issue, it is a workforce issue. So it's been a considerable effort, but as we've grown as a coalition, we've been able to get louder in putting early care and education at the forefront.
Access to quality childcare that not only allows parents to go to work, but provides businesses with the reliable workforce they need to recover is incredibly important. We established early on the Early Care and Education Commission at the state level. And I have to tell you that Early Care and Education Commission found that it would take for Louisiana, $115 million of investment with subsequent investments for the next 10 years for Louisiana to ensure that at-risk children who need access to early care and education programs would actually be able to access that. This year, we were fighting for what we thought was going to be a significant investment, because I have to tell you, despite the fact that we know these challenges, despite the fact that we've demonstrated what research is telling us on the return on that investment, we knew that it would take this diverse coalition of stakeholders to be able to engage so that it was no longer considered a woman's issue or a not-for-profit issue, that this was going to be transformational for the economic well-being of our state. So we actually not only made it a priority for our partner organizations to join us, I could tell you, in addition to actually getting on the ground and working with our childcare centers, I was astonished personally to understand that so few people had ever in the legislature visited a high quality early care learning center. We made it possible for them by hosting the first ever Early Care and Education Day, not only at the Capitol, but locally throughout our state, hosting programs that gave legislators the opportunity to walk in and meet those executive directors, engage with the children, and understand just how high quality makes a difference in the lives of those precious children that are being served. We partnered and also kicked off an incredibly important program with Tulane University, because we wanted very much for our elected leaders to understand the brain development and the brain architecture that is so critically important to be understood, and why increased investment and access to that not only accelerates the child's ability to start school ready to learn, but more importantly, allows them to be able to have access to the critical screening issues that are necessary in an early care environment for that child, should there be any gaps that that child has in attaining their highest quality social, emotional, and educational attainment, that's caught early on, so that when that child enters school, they are ready to flourish at their highest potential. Candace?
Yes, absolutely. Next slide. So a couple of wins that we're really proud of since the formation of the coalition. So back in 2019, we helped secure over 18 million in funding. And so this was the first time that early care and education had received new investments in over a decade. And just last year, we were able to secure 25% of sports betting revenues. Now that is up to a $20 million cap. Our job is now to remove that cap, but that was a significant win for us. And actually, Charmaine, you can speak a bit more on the sports betting revenue since you were front and center on that.
Well, United Way of Southeast Louisiana and the Ready Coalition did a major advocacy effort. And let me just tell you, it didn't take 1 year. We worked on this for literally 2.5 years, where we knew that sports gaming was going to be very popular here in the state. But in order for us to get that passed, we knew that there was going to be opposition. If we played our cards right, we could build a sustainable business case for why any financial resources realized in that ought to be dedicated to early care and education. So we passed Senate Bill 142, which became Act 435, which committed 25% of sports betting revenues up to the 20 million cap to early care and education. The funding will provide a dollar for dollar match from the state to local investment in early care and education. I think it's fair to say that we realized early on everybody's got a stake in early care and education, and everybody needs to step up. This cannot be only an issue that the state carries the weight for on its shoulders. We know that those children and those families live locally. We must engage them. And in order to do so, we needed to create the Early Care and Education Incentive Fund, which could then get the resources necessary to match local investment in high quality early care and education throughout our 64 parishes by incentivizing and matching what they did. I'm pleased to say that the first community that stepped up to actually invest their dollars was under the leadership of Mayor LaToya Cantrell and the city of New Orleans. They invested their general dollars at the tune of $750 and then grew that $750 to 1.5 million, then grew that 1.5 million to 3 million. And now we had the most incredible success because as a result of our coalition's work with local municipal governments, we were able to pass a millage this year in the city of New Orleans, 5 mills, which will create a fund for early care and education, $21 million annually for the next 20 years. So that made the work we were doing at the state legislature in this legislative session even more critical, because we made a commitment to local municipal governments that if you invest, we will match that investment. So the work that we are doing this year at the state capitol was to ensure that we got the dollars necessary to hold steadfast to that commitment. And as a result of what New Orleans led the way for, we are now looking at communities in Jefferson Parish, in Caddo, and in Shreveport, and Monroe. Individuals are stepping up, and we now have to be able to secure the long-term sustainable funding necessary to make this a local, state, and federal initiative that allows every child and every family in Louisiana to access high-quality early care and education. And this year, in this legislative session, I have to tell you that just yesterday, the state Senate passed our recommendation to provide $84 million in early care and education funding. So Candace, I'm gonna allow you to talk about that because it's quite an achievement. And we hosted our Ready Coalition call just this morning to talk about that achievement, which is a milestone.
Yes, yes, very exciting. And so we are actually still in session, but as Charmaine said, we have secured another significant down payment for early education programs. And so the number has changed a little bit since we put this slide together, but we are anticipating $84 million in state funding for Louisiana's children. And so a portion of that will go into the incentive fund that Charmaine talked about. And then the other portion will go to our child care assistance program and then maintaining our PreK program throughout the state. And so we are very excited. This coalition has been truly critical in galvanizing support, engaging our legislature. And so we are extremely excited about that. And the work will continue until every child has access to quality care and education. And so, like I said, our session ends in a few weeks, but it has been a tremendous effort. We had Early Ed Day at the Capitol just last week, where the rotunda was filled with early care providers, early childhood champions. We received resolution from both the House and the Senate for our work. And so just we're building momentum. The coalition continues to grow. It seems like every time we have an event or communication, we get more inquiries and more businesses are joining on because we really do understand the economic impact. And if anything else, this pandemic has exposed the vulnerability in our economy when there are child care breakdowns.
Well, and I think that one thing I'm really proud of is the extraordinary work, because I've really appreciated the fact that so many of the speakers before us have really talked about the challenges that are unprecedented, because whether you're facing a natural disaster or you're facing a pandemic, we understand the critical need to address and convene regular communication with our early care providers, because I have to tell you, an important side of access to high quality early childhood education is the equation of infrastructure. Parents need quality, affordable care centers in their area, and many centers consistently have long waiting lists. We know that childcare centers often operate on razor-thin financial margins as they balance the cost of providing high quality levels of care. The pandemic-related lockdowns and additional costs place just an unsurmountable burden on these early care centers, which, as so many of you have said, are run by women, and in our area, predominantly women of color. I could tell you, for us, we felt a moral obligation to understand it as quickly as we could, the fact that these small businesses, our childcare centers, were not going to be able to have the capacity to be able to understand how to draw down federal funds through the PPP program. So I want you to know that our United Way launched what we call the Early Care and Education United for Early Care and Education. We partnered with Loyola University College of Law, and we were able to work with 81 childcare centers with an investment of $100,000 from our United Way. We were able to secure for those 81 centers the opportunity for them to draw down over $6.5 million in forgivable loans. Now, I have to tell you that in and of itself is transformational to those centers who were looking and trying to they were drinking from a fire hose. They were trying to survive in this pandemic. Had we not stepped up and given them that helping hand, none of them had the luxury of being able to have the capacity and staffing to do that. So we couldn't be more thrilled about that. But I think the investment in this work has positioned us so well to be better able to handle the next disaster, God forbid, whatever that may be, because we are building strong business resiliency within these childcare centers.
Absolutely. And so the next slide, just to give you all a visual of the Ready Louisiana Coalition, these are the logos and symbols for some, not all of the organizations, but the majority of the organizations that are part of the coalition. As I mentioned, it is still growing, but this is the support and organizations we've been able to garner thus far. So I think we are at time for Q&A, or Kent, I think we will pass it over to you.
Yeah, thank you all so much. Yeah, and I think we can go into kind of discussion mode here. Well, first of all, what impressive growth you've seen in such a short period of time. And I know a lot of folks who work nationally, we're always looking at Louisiana and just marveling at some of the amazing things you're doing. And the creative financing that I think you guys are working through at local and state level is wonderful to see that. I want to bring us back we have 15 minutes left. I really want to bring us back to something this panel I know cares deeply about, because we did the planning call and we've touched on it throughout the different presentations, but I want to bring us back to that issue of community voice and maybe get a little more specific, or have each team provide an example of a strategy they use to engage community voice. That can be families and parents, it can be providers and teachers, it can be marginalized populations. So I would encourage anybody who wants to talk now to raise their hand. We'd love an example of that, because we really want to dig into that and share with our audience practical ways they might approach engaging community voice to create greater impact, be more efficient, more effective. So go ahead and raise your hand. I'm not going to call on teams. If you'd like to offer an example, raise your hand and I'll try to call on you right away, and we will get into that piece of the discussion. And yeah, Eric, you can go ahead and stop sharing the presentation. We'll just turn to discussion. Cicely, thank you.
Yeah, sure. Happy to share. So in our design of these regional councils, we will have what we call a regional action council, which will be a variety of stakeholders, those elected officials, business people, a variety of folks. But we also are going to have a standalone in the same region family council, because we realize, one, a lot of parents might feel very comfortable sharing in their own space. And so you might not want to say something about an experience you had maybe in a school-based center sitting next to the superintendent or principal. So we want them to be in a space where they can share freely and encourage and build upon each other. We also realize that lots of spaces the parents are invited to sometimes have barriers just because of time and place that they're meeting, right? So we want these councils with the families to really be able to have freedom to schedule meetings that work for them and their family schedule. And so we wanted to make sure that we were intentional about having I don't want to, well, I guess I would say kind of more family voice, right? Or at least parallel family voice to what we would call our kind of other stakeholders, or what people might call community leaders, although we would say parents are also leaders. So we do have a couple parents who will be on that action council with other folks, but we do have standalone family councils. And really we'll be looking to those family councils to make sure that everything that was talked about in the region really is almost vetted by them, right? So it makes sense for them as well. So we don't want the narrative to go out that, hey, that the cure to early childhood expansion in whatever region is just that we need more preschools because everyone loves preschools. We want to bring that back to the parents and ask them what their experience has been in preschools.
Yeah.
What might be the barriers? Are the preschools located in places that they can get to, right? The places that they feel comfortable dropping their students off. And so that's the way we're going to make sure that we really have a space to highlight parent voice, and that they really see themselves as leaders in this, right? Because they are the one accessing our care systems or not accessing our care systems. We want to make sure we bring that qualitative data point to the state versus the, kind of quantitative data points that we use that can, depending on who's looking at them and what our interpretation is, lead us to make an incorrect solution.
Yeah, and that's very similar to the Head Start model. Every Head Start program has a policy council made up of parents and families. So love that model. Are there specific things you're hoping to get out of those family councils in specific you're looking across all those councils for, or is it a little bit more organic what the families bring to the conversation?
So as Ceci mentioned, in this first year, we're really looking at them to give us the region itself to give us kind of a regional scan. And so that's all the demographics, kind of all the slot gap analysis, all of those things per region. And so we can understand that. And then what we're looking to the families to bring in is really, again, that qualitative piece. And so to understand, how they've gone about accessing care. And we'll have those 15 or so families on that family council, but we know they don't represent, again, the entire swath of families within the region. So we'll be also asking them to help us as they're comfortable to reach out to their peers and their other networks. And so those Head Start providers and family providers. Yeah, because they are the ones who have those organic relationships more than sending in a business owner to try to meet with parents, right? And so we want to make sure that space is really clear for them. And then we'll add on to that second year of really the whole child. And so bringing in healthcare providers and a variety of people to make sure we have that scope as well.
Wonderful. Rachel. Thank you.
Yeah, I wanted to speak briefly about our Family Voice Council. I know I mentioned it earlier, but we have 19 family members from across the state. We've made sure we have good regional representation from every region. And all of the family members have children ages birth through 5 and have participated in publicly funded programs and services. And I also make sure that when we recruit, we also represent a wide array of services and programs utilized. And each month we have a different program leader come in from a publicly funded service to talk about initiatives, any changes they're thinking of making, and the family members give feedback about how it impacts them, how it impacts their lived experience. And then I close the feedback loop as a facilitator. So I follow up with those programs and say, what have you done with the feedback that you received? And I report that back to the family so that they can actually see how their voice is having an impact. First Steps is also really good at feedback loops and does feedback loops with all of our programs. And then also we have a needs assessment that's done and is currently in progress. And part of that was a large scale survey across the state. And from that, the Family Voice Council did a meaning making session with that researcher to help develop the direction that the one-on-one interviews would go. And those have been happening from January through now. We did that in lieu of focus groups because of COVID and its impact on families. And so we also, did it that way and solicited leads from all of the different counties in South Carolina, especially ones that had been underrepresented in the survey, to make sure that we were including families with a wide range of experiences, for further qualitative data.
Those are great strategies. Last comment here is going to be from Georgia.
Yeah, I think it's important also to remember that there are different populations we need to hear from. So while our Family Voice Council are people who are described as Rachel just described them, there are sort of different ends of the spectrum of families that we oftentimes leave out when we're lifting up family voice. In some cases, those are families who are not part of the public benefit system, because they exist on one or the other side of that spectrum. So when we did a 1,000-person survey, over 1,000 people during COVID, we were very intentional and used some bot social media strategies, frankly, to proactively reach out to families who are not public service beneficiaries, because maybe they're outside of the income range, but still interact and exist with our public service system. On the other end of the spectrum, when we did a preschool development grant funded needs assessment and heard from over 5,000 people back before COVID, we had in-person focus groups and tasked our local partnerships, those in every county of the state, with having at least one of their 2 focus groups with families who were not participating in any public programs. And so that was a way to really directly hear from people who, for one reason or another, were not able to, or were not choosing to interact with that public system. And that was just really, really important for us to hear.
Yeah, and it can be harder to reach those families if they're not on the radar, but it is so critical to think about everyone in your community or your state. So we're going to go and wrap our session now with my favorite part of all sessions I do, which is our call to action. And I let my panelists know it can be personal, it can be professional, it can be anything. So I'm going to call on each of our panelists, and if you could just take 20 to 30 seconds maximum, we're going to hear from them, their call to action to you as we depart our shared space today. So I'm going to go and start with Texas. Nicolai, would you kick us off?
Yes, sure. I think I just want to part with this statement that when building or launching any type of initiative for community impact, you have to realize that it does take time. It does take time and patience, and it's a community effort. Like, you cannot work in a silo and do this particular work, but you expect change to happen over time, and you learn from your setbacks, because you should always have like a continuous improvement model that you follow for learning from your setbacks and failures, and modifying or going forward with those lessons learned. And also always include the voices or elevate the voices of the population that you're wanting to impact the most.
Thank you so much. Jacqueline.
And I would just echo everything Nicolai said, and then just add, for the community, if you ask if this is a newer thing for you to do and then they're not as forthcoming, think about who is in the community, who is asking, who is leading the interviews, who are leading the focus groups, what are the paradigms. And a lot of times the communities who are historically marginalized have not had a voice. So what are the questions you're asking? If you're not getting answers with these questions, what are the questions you're not asking?
Yeah.
So just listen deeply.
That's great. You sound like an organizer thinking about power and everything. I love that. And so our next team, Cicely.
Sure, I would say echoing on the just being patient. This is a heavy lift. I know in our state we brought together this convening. People gave lots of input, but you tend to think it's everyone, and you realize it's 30 people, and that is not everyone. And so in this work, you really need to go out. We did a lot of work in listening to community. There were lots of concerns. There was lots of mistrust that will exist. We understand that. We try to come very open and honest, and we also do that feedback loop. So we plan to do that obviously with the parents, but we've done that in community. So as communities have voiced their concerns and their mistrust and even their hesitancy, we go back, right? We answer the questions. We try to modify the program best we can. We explain if we cannot modify it. And I think through that process, we have gained some trust. I think we will continue to do that because if we're doing true collective impact, this really is a system that should work for everyone in our state. And really, we're centering the parents and providers. And so us as staff have to make sure that if we're centering them, we hear from them, we respect what they have to say, even if we don't agree. And then we always keep coming back with a hand of how can we improve this and make this work for you. And I think the patience part is, particularly with our families, is understanding they may not want to come to this table. They've been to many tables where people have said their voices matter and they realize that it hasn't changed their life. And so we don't oversell what we're doing. We do invite them, but we also say whether they come to our table or not, we want to hear from them. We will continue to do that with our staff throughout the state and anything that we put out on this side. One thing we have realized is that we've translated now in 5 different languages. We don't get focused on who's looking at our website and who's clicking on what box, but making sure the stuff is available, because even if it's just one person who's looking at things that aren't Arabic, it's one more than we had before. And so I think as we build this system, we want to make sure that we are really designing it and really over communicating about this being centered around parent and providers for their benefit, but also that our state should be responsive to what they are saying if we really want to meet their needs.
Great, thank you so much. Ceci, what's your call to action?
Similar to the earlier comments, I mean, I agree with Cicely. It's about I think our goal should be about building power at the local and regional levels, right? That's not a side product, that we really do go into this to build power so that they are the change agents, right? We need to not just include, but to build power and leadership at the community level, at the parent level, at the provider level, because that's going to create and sustain the change that we need. We have a long way to go. I mean, I'm thrilled to have this conversation and to hear the examples across other states. And it sounds like we're all on the same track, because it took us all a long time to get here and we all got to the same place, right? So we have to do things differently. That's hard for people, but I think keeping at it and making sure that we're in the process building power so that this process continues to grow.
Wonderful, thank you. Rachel.
I'll just echo what everyone else has said. And part of that is leaning back. And so what I mean by lean back is look at the whole system and then think of what those thread points are and ways that we can work together. And in that, listen, not just to all of the stakeholders, but also the people doing the work about, on those front lines about what their needs are as service providers, and then amplifying those messages to, the program leaders and policymakers. And so that's really, I think, at the center of human-centered design is lean back.
Wonderful. Georgia.
Lean back and connect the dots, because we all have a shared stake in our future. So that family who I had the chance to talk to at the park had the same desire as our governor's desire, which was to reopen our economy and go back to work and see children thriving, starting school ready for success. And I think so often we talk about listening to families as if their desires and needs are different and maybe contrary to what our policymakers' desires and needs are. But the reality is we need to work together lockstep and see those places where our collective efforts can lift up all of our shared values, and we have those shared values. So I just would offer that up, that sometimes that has to be done explicitly.
Excellent. And our last team, Charmaine.
Well, I certainly agree with everything that's been said before, but I think building community trust is at the forefront. We must be culturally sensitive to communities that are not eager to actually engage out of fear. We must be able to step back, engage with those trusted partners on the ground that they trust, and we need to be able to return over and over again. To me, community conversations are incredibly important, but I would also say, as we look at how we're going to be embarking, if you're not in the game of policy and advocacy when it comes to sharing critical information during election time, you need very much to be engaged in that conversation so that this issue remains at the top and at the forefront of every individual running for office at all levels of government. You need to get their commitment. You need to make sure they understand and that you continue to educate them. And I would say an effective communication strategy is key to enhancing and accelerating success.
That came through very clearly in your presentation. I love that. And finally, Candace.
Yeah, so echo everything that everyone has said. I will say that childcare is the common thread that almost everyone is willing to talk about. And so I think, to Charmaine's point, if you can paint the picture that children are an investment in our future and the economy, and then be able to quantify what those impacts are, I think more people will pay attention and be willing participants in the conversation.
Wonderful, wonderful calls to action. It's been my honor to moderate the panel. I want to turn it over to Amy Cubbage to close us out.
Thank you very much, Kent, and many, many thanks to all of you who served as panelists today, bringing your voices from incredible initiatives that you are engaged in to South Carolina, to Dallas, Louisiana, Illinois. We are so proud to be in partnership across state lines with all of you, learning from you, sharing lessons. This was a wonderful conversation. I have many, many notes. If I had more minutes, I was going to do some shout outs on it, but just a huge thanks to you and to the folks who took time out of their day to join us today. The chat box and the Q&A was also energizing and enlightening. Thank you for those questions and your participation. Don't forget, next week is our last featured session, Thursday, May 26th. From 10:30 to noon, again via Zoom, and we're excited to focus in on that next conversation, which is, let me remember what one we're at, exploring national, state, and local workforce supports for early childhood education. And a final shout out, which is to our wonderful comms team. Thank you so much for supporting these featured sessions as well as the entire conference. I hope you all have a wonderful rest of your Thursday, and thank you again for joining.